Hi, welcome back. I'm Dr. Kenny Levine with Health Talk, UVerse Channel 19, WEYW19.com. I'm here with Dr. Cory Lessner. At the previous segment, I said we use the laser in our practice, and I can tell you the hertz, I only go up to like 40 hertz for treatment in the mouth, and I can treat gum and bone and teeth with this laser, and we do miraculous things. I get a little nervous around my eyes. You know, I have a terrible blink reflex. My daughter and a lot of my friends wear contact lenses, and I can't ever imagine going near my eye every day to put a contact in, or they have extended wear and things like that. I read some information that said that wearing contacts long term can cause some damage. You want to talk about that?
Well, I think if people had any idea about what's happening at this very moment, there are dozens of people around the country in emergency rooms that have corneal ulcers or infections from the contact lenses that may permanently cost them some of their vision. That just doesn't happen with LASIK, but you're dealing with a business that's multi-billion-dollar per year business. And you know, we're still dealing with the legacy of LASIK in its early years, where, again, blades were used, which were not quite as safe. I mean, in my hands, perhaps 1 in 2,500 eyes, we'd have to not continue the procedure that day and bring the patient back a couple of months down the road. Now it's 0 in 2,500 eyes with the lasers.
The Wavelight EX500 excimer laser features a completely sealed, nitrogen-flushed beam path that is checked in 3 separate locations for energy and consistency, thus setting the standard for both laser precision and durability. Pupil dilation causes pupil centroid shift, or a shift in the visual axis. The Wavelight EX500 excimer laser is able to compensate centroid shift and make necessary adjustments to align with the predetermined treatment profile. The Wavelight EX500 excimer laser maintains a high pulse frequency with a minimized thermal load, allowing only 1 in 5 pulses to overlap. This allows the treated area of the eye to cool before receiving additional pulses from the laser. This treatment algorithm provides a market-leading treatment rate of approximately 1.4 seconds per diopter. Designed to automatically track movements of the eye with a latency time of just 2 milliseconds, the Wavelight EX500 excimer laser automatically adjusts pulse placement to provide patients with exceptional precision and safety.
Is there any relapse after the procedure? Does that have to be done again for any reason?
Well, the procedures treat that moment in time. So if a person has a -3 prescription in their contact lenses, and they're 25 years old, and at 18 they were a -3, and if we were able to look forward at 32 they would have been a -3 as well. If I treat the 3, they should have no prescription on their 32nd birthday. We just look for relative stability, or we can also give a little bit of extra prescription for the young person to grow into in terms of the treatment.
I know in the work that we do, we don't put dental implants in a teenager until we have evidence they've stopped growing.
Right.
We do serial cephs, or they do wrist x-rays and things like that. Is it common for people to continue to change the shape of their eye, change their prescription?
Usually people know. They can tell us, we can look at a pair of glasses they're wearing that's 3 years old and compare them with their current prescription to see if there's been a change, say if we don't have the records. But it's really about lifestyle considerations. There are people that you know, are more active down here in Florida. You know, they scuba dive and need special lenses in their mask, or they have to wear contacts, they should lose them. The occupations, like people who are firefighters that don't have correction, it's really difficult for them. The glasses they have inside, the masks, they fog up. So there are different reasons. Military, I mean, I wouldn't want to be, you know, stationed overseas in some of the environments that these people are in and not be able to at least adapt, get by without, you know, with my natural vision, if it wasn't close.
Are there any medical conditions that would prevent some illnesses that would prevent somebody from having correction?
Sure. We don't do people who are pregnant or nursing, because we don't want to give any of the antibiotic to the child in utero or through lactation, through mother's milk. People that have active rheumatoid and lupus, active collagen vascular diseases, if they're stable on medicines, we can do them. One contraindication is if a person's had herpes in the eye specifically, we don't like to do treatments on those people. And then obviously there are corneal weaknesses, things like keratoconus that
Okay, we're going to get back to that in just a moment. It's Dr. Kenneth Levine with Health Talk. We'll see you in just a couple minutes. Thank you.